Hey, this is Dr. Sigmund with CORE Chiropractic, and today we're here to talk about neck pain. Now, there are 3 tests that can be used to determine what can be causing the neck pain. Whether it be an issue with the nerves coming from the neck, that can be causing the neck pain, or it can be radiating to the shoulder, the arm, the hand, causing numbness, tingling, or it can be coming from something like a disc in the neck as well. That can be swelling, there can be bulging, could be herniation. And the 3 tests that they use to determine that, or that a chiropractor would use, would the first one be called the Spurling Test. The Spurling Test means that whenever the patient has their head turned from one side or the other, depending upon if the pain is coming from the left or the right side. They can also be tilting to the left or tilting to the right. And then what the examiner or the chiropractor would do would be, as they're tilting from side to side or turning, they would apply pressure to the top of the head. And what that usually would do, if the person has a problem with the pain going down into the arm, is it would provoke that, or that it would get worse. That's usually a sign that there is a nerve irritation or compression, or what we call a subluxation in the spine, that's causing the pain in the neck, and also where that nerve travels, which can go all the way down to the hand, to the wrist. And that's the Spurling test. Now, the second test that we use is something called the distraction test. Now, distraction would entail the examiner coming behind the patient and taking their hands and actually lifting up onto the neck. Now, if that lifting of the neck causes the pain in the arms or the hands or the neck to go away, that would also indicate that there is some type of a nerve compression from the subluxation that's occurring. Could also be causing issues, relieving that pressure like from the disc as well. But that would determine a positive test if the pain essentially in the neck or the arms or hands would go away as that neck is lifted up. And that's called the distraction test. Now, the last one that we use is something called a Valsalva Maneuver. Now, this is just where the examiner asks the patient to take a deep breath and bear down and hold it, almost like they're going number 2. But that increase of that strain and that pressure will cause what they call intrathecal pressure in the neck, and that actually will narrow the area around the spinal canal, which can put pressure on the disc. And that Valsalva maneuver lets us know that if it provokes the pain or causes irritation or a symptom, then it usually means there is some type of a disc irritation or a bulging in the neck that's causing the problem. So those are the 3 tests that's used that are most common for having problems for people who have neck pain. And that's very easy to do, very simple, but allows the chiropractor to determine what the actual root cause or problem that the patient is having. So appreciate your time. If you're having any of these issues or symptoms, make sure you contact us here at CORE Chiropractic or your local chiropractor, and make sure you get checked out and get those problems corrected. All right, y'all have a great day.